A federal judge has blocked the National Institutes of Health from implementing cuts to medical research grants under the Trump administration. That's after 22 states sued to halt the process. In a post Friday, the agency said it planned to limit those funds to 15%. Now, officials noted that $9 billion of the $35 billion given for research in the 2023 fiscal year was used for administrative needs rather than direct research. Now, those funds cover things like lab space, safety equipment, and payroll for support staff. President Trump proposed similar budget cuts for the National Institutes of Health during his first administration. Now, the move never received congressional support. CBS News digital reporter Alex Tin joins us now. Alex, thanks for being on the program. What can you tell us about this federal ruling and what it means?
Yeah, well, it's important to remind viewers that this is a temporary pause on the decision. It's pending a federal court case that was just filed this morning by those 22 states and is going to a hearing on February 20. So we're going to find out in the next couple of weeks whether this is going to be a permanent pause on this policy change or just a temporary, short-lived one. The other thing that's important to remind people at home is that this is affecting not just future grants. The reason these states sued is it's affecting grants right now. You know, research institutions go through these extensive negotiations with federal health officials. They undergo inspections where health officials come and they say, what are you really using this equipment for? What are you really using this building for? And as a result of that, they come up to this negotiated agreement of how much money the federal government is going to pay for those so-called administrative costs. Keeping the building up, turning the lights on, paying for the security. Changing those overnight without going through those negotiations again is something that the states say is not just unfair, but illegal.
And just for some context, when they announced this, it's going from 28% to 15%. Some foundations like the Bill and Melinda Gates Foundation, they are at that 50% already. So just kind of putting that all into context, I do want to ask you, the Trump administration says these cuts will save more than $4 billion a year. How could many medical researchers, how many patients could be affected by this?
Yeah, it's hard to understate the scale of medical research in the United States that is subsidized, at least in part, by the NIH. As you mentioned, yes, it's true. Lots of other foundations contribute money towards medical research in the U.S. Nobody contributes the same amount of money that the NIH does to subsidize those costs. Again, keeping those labs open, keeping them safe, keeping the doors, working, and keeping the equipment up and running. Obviously, there is a larger conversation here that's been going on for many years, calling for cuts to how much the U.S. pays for that. But of course, the complaint that you're hearing now, not just from research universities, but states, as well as some lawmakers now, is that this isn't the way to make those changes, that it's not something that the Trump administration should be able to do unilaterally. It's something they say should be up to Congress.
Certainly an ongoing discussion we will see. Alex Tin, thank you.
Thank you.